The British Society of Vascular Surgery was first to rename itself British Vascular Society. A step in the right direction?
I think it was an attempt to try and recognize the facts of life in the sense that it's not just surgery, it's also endovascular procedures, and it was an attempt to embrace other specialties in the future. That was the idea. Whether that works or not remains to be seen.
What kind of challenges faces the British Vascular Society now?
Well, the first challenge is to become a specialty in its own right. We are not a specialty at the present time. Many countries in Europe are specialties, we're not. We are trying to become a specialty, and we have tried also to get together with the radiologists and form a core training course, which we have now agreed to, and there will be a joint training of vascular surgeons and also radiologists for 6 months working in a suite, angiology suite, and they'll be trained by the radiologists. So that's a big step forward. And then we want to become a specialty from there on, and then change the training, because it all boils down to training. We cannot say we can do all these procedures unless we've been trained to do so, and that's our aim.
Tell us about the particular endovascular graft you and your colleagues have developed.
Well, Juan Parodi, Frank Veith and ourselves, we all by pure chance used the same graft way back in 1992, which was based on using what was available at that time, dilating 8 millimeter PTFE, a large Parma stent, a large balloon and various sheaths, homemade devices. We all used them independently, and we found that the results were very good. 10 years later, we have seen no migrations, for example, with this device, and nor, I think, has Frank or Juan. And we believe this graft is a very good basic concept, a balloon expandable device. And Datascope, we have now converted that from being homemade to being produced commercially, and the company is called VI, and Datascope has taken over the distribution of this device, and it's going quite well at the present time. It's a good device for dealing with difficult cases and ruptures, and that's where its future lies at present.
Will vascular surgery be absorbed by a global vascular specialty?
I don't think it's a matter of absorption. Surgery, you have to remember, does not mean taking a knife and cutting somebody open. Surgery means an intervention of some kind. The name surgery is still relevant as it ever was. I think it means more of a coalescence of different special interests. For example, I think that the radiologists and the surgeons will come together to form what you call them. I couldn't say at the present time, but it doesn't matter whether they're called surgeons or interventionists or whatever. I think the cardiologists will always be separate because they deal with the heart, and I think that's where the intervention or the interface will lie in the future. So it'll be, I don't think the name will necessarily change. It doesn't matter what the name is. It's the training that matters.